before I go into this content, remember we're talking about personal injury tales, so let me just kind of set the stage here of what's going on and really where we're at. Remember, personal injury attorney sales is very lucrative because there's a huge potential market. Remember, only 25% of personal injury attorneys actually proactively manage their case and refer cases out, and only 32% of personal injury patients see chiropractors or CAM providers. Not even that number is not even chiropractors. That's CAM providers, of which chiropractic is the largest percentage. So 68% of personal injury patients do not get chiropractic care, and a large percentage of the personal injury attorneys do not deal with chiropractors. So that's the good and bad news. So there's a huge potential market, but that's why we need to do sales and not advertising. But just be aware that when we go through personal injury attorney sales, that remember that we want to set the stage depending on, in other words, you would not want to do this presentation in a cold call. You would want, because remember, we're trying to affect 4 factors: trust, defenses, resistance, and confidence. Well, if I've already done some things to affect trust and decrease their defenses, they're going to be much more receptive to this presentation. If you have a cold call or a lead and you didn't do any homework up front, in other words, there was no contacts, there was no visualization, there was no interest in being stirred, there was no authority being stirred, there was no personal story. In other words, there were no emotional triggers to affect the attorney's defenses or resistance. You're going to have a much more difficult time of this presentation working. So this is why we want to do several things prior to this presentation. Things meaning triggers. We want to pull some emotional triggers prior to this presentation, and that's why we do the publicity. That's why we do the advertising videos to gain their attention. That's why we do multiple contacts. That's what all that is about, is to position, and hopefully we started with an introduction active-passive referral category in your list to begin with. So let me just set the stage and just be highly aware when you do a sales presentation, it doesn't matter what sales presentation it is. When you do an educational sales training, and that's probably the words I would use. I wouldn't use sales with attorney. I'd probably call it educational training. Sales just is a negative word to a lot of people. Educational training is probably the words that I'd use. So when you do your educational training, just be aware that you have to have some leadway in to increase its effectiveness, and you'll see. So we're essentially on the S-curve, who are we dealing with here? We're dealing with potential personal injury attorneys to get their business. These are attorneys that basically presently aren't using chiropractors or your service, essentially. And that's where the huge market is. So let's go ahead and get started and talk about this. And remember the objective, there's 3 objectives. We have to take somebody, a target market who does not have a perceived need. And that's that 75% of attorneys, or 68% of the patients. If there's not a perceived need, you have to take them through 3 phases. You got to take them through the admit phase, the consequences, and the personalization. And that's exactly what this presentation does, step by step, and it baby steps. So there's many factors to consider, and we're going to do a summation at the end on how to deliver components, on how to what's important in delivering the content, not just the content. So we're going to make sure we take this this presentation takes them through the admit phase, that they admit the consequences, that they see that it's consequences and it's personal and it's painful, because that's what motivates them. And then we're going to personalize it, make it very personal to them, to get them to see how it's personally affecting their lives in a negative way by not knowing or doing or dealing with somebody who has this ability. That's what motivates personal injury attorneys. So we're going to say we've already set the stage with some publicity, some emotional triggers in other marketing categories, whether it's with DVDs or mailers, etc. to get to this meeting. So we have a higher trust introduction, active referral. So here we are. And we're going to, when we do this meeting, we're not going to want to do it in an open setting with a group of people because none of us likes to look stupid. And our defenses will be even higher in the presentation if I have a peer group around me and you're kind of showing me how, because essentially you're going to show them what they don't know. And none of us likes our peers to know what we don't know. So you are not going to want to give this presentation in a group setting. This is an individual setting that so you can work on them personally and not get the defensive. We're paying a lot of attention to trust and defenses and resistance and confidence. A lot of attention to that to get this message in. So here we go. First, we're going to start with we want to start, this is called a preemptive strike or upfront contracting. We're going to start with the number of PI cases that personal injury attorney has a month and the average settlement. And the reason we need to start with that is you'll see as we go through the presentation that they will go into a defensive mode to some degree. And if you don't get this up front, you won't get it when you need it. So you have to get it now when they're not defensive and they're not suspecting anything. So you need to get the number of PI cases a month that they average and the average settlement for your area. Now you should know and find out what the average personal injury settlement is for your area. And I'm not talking about broken bones and fractures and stuff like that. The common soft tissue injury case, what is the typical settlement? You're going to want to know that figure. And so I'll share with you the topic, and then I'll share with you how I would say it and its relevance. So here's number one. Start with the number one PI cases and the average case. So here's how it would sound. By the way, Mr. Attorney, if you don't mind me asking, that's called a softening statement. Anytime you're going to ask a high confrontation topic, it's always best to start it with what's called a softening statement. If you don't mind me asking, Mr. Attorney, just roughly how many personal soft tissue injury cases a month do you get on average, just roughly? And so we do want him to put a number. We don't want a high number. And if he says a high number, we want to bring it down to realistic. And we don't want a low number. We want an average number. So on average, just roughly, 1, 2, 3. If he doesn't, and you have to be aware, if he doesn't give you an answer, you have to ask it again until you agree to a number. Now, here's another concept. You have to, it's called reversing. When you cover a topic, you have to get an agreement with that person before you go to the next topic. Now, that's just a rule in communication in general. Doesn't matter if you're talking to a patient or spouse, or it doesn't matter what you're talking about. But this is very important because this is a stair-stepping effect. And if you don't get agreements all the way through, you're not stair-stepping him into the hot water, because that's where we're taking him. So it would sound like this. Mr. Attorney, if you don't mind me asking, and I know it could be somewhat of a personal question that's stating the obvious. Mr. Attorney, if you don't mind me asking, and I know it can be somewhat of a personal question, but just roughly how many connective tissue personal injury cases a month would you say you get? Just roughly. That's what that would sound like. Very soft. And then get the number, 1, 2, 3, 4, whatever the number is, and then write that number down. And so you're saying basically it's about 2 cases a month. Is that what I'm hearing? Okay. And nothing big, nothing small, but on average. Okay. Then you want to get the agreement. The next step is the agreement on the 2 payment systems. Well, in your particular, the attorney's injury claim is going to be paid by either a trial and a jury, or it's going to be paid by an insurance adjuster using some type of software, probably Colossus. If not Colossus, another type of software. I need to get that agreement. So basically, when you have an injury claim And this is what it would sound like. So, Mr. Attorney, when you have an injury claim, basically your payment is going to come from two sources. Mainly, it'll come from an insurance adjuster. That's where most cases in what you negotiate with that insurance adjuster. And in all probability, that insurance adjuster is using a software program to guide them, such as Colossus or Colossus type software. You're familiar with that. You would agree with that, right? And if you can't come to an agreement with the insurance adjuster, then you have the ability to sue. You have the ability to take this case and ask for a trial by jury. And now the jury makes the decision, not the insurance adjuster. So when you agree that those are the two systems of payment, that's dependent on your injury claim. That's what it would sound like for that particular. So I'm getting an agreement. By the way, what I'm doing is I'm taking it out of third-party hands, not his hands. I want to take it into what's called third-party hands. The jury are the insurance adjuster, and this will make sense as we move along. The next step, you're going to get an agreement on the financial drivers. And so this is what it would sound like. So, Mr. Attorney, basically your injury claim is based primarily on financial drivers, essentially. And in my experience, these are the financial drivers that I'm experienced with, especially with Colossus type software. And one would be the injury diagnosis would be number one. That'd be the number one financial driver. Number two would be the impairment rating. Number three would be what's called the loss of enjoyment of lifetime activities. Number four would be what's called duties under duress. And number five would be the prognosis, restrictions, limitations, or inhibitions. Now, would you agree that those are the main sources of your financial driver for your injury case? That's what that would sound like, okay? And let me point out one other thing here. You are not to get into an argument with these people. So if he disagrees with some part of what you just said, write down what he just said. Would you agree that if he says, the impairment rating's not, that's overrated or whatever, I'll go, okay, well, let's just minimize that. And what would you say it is? And just write down what it is he says. So you're going for agreements. You're not trying to tell them. It's a mutual relationship communication. So go for agreements. Next, especially in the beginning of the presentation, we're not looking to get into a confrontational, cognitive, who's smarter than who discussion. Be very careful of that. Now, the next topic is, well, let me share with you the three phases of healing. Now, what is the key point here? The key point that you have to be aware of as the healthcare provider is the attorney has no interest in this. They don't care, and they have no interest in the three phases of healing. And the example that I use is if the attorney said to you, hey, let me share with you, doctor, how to write a brief. Well, how much interest would you have in writing a brief? That's not what you went to school for. That's not what you want to do. That's not where your interests are. You have zero interest in writing a brief or how to write a brief. Now, my point in saying this is you always have to be aware of your target market. How do they think? How do they feel? What's their paradigm? So the key point here is they don't care about the three phases of healing. So here's how you handle that. You have to, it's called state the obvious. Let them know that that this is not interesting to them. Tell them that up front before you get into it. It's called upfront contracting, and what it does is it minimizes the reaction that you're going to get. That's what the dynamic of that type of communication does. So it would sound like that. So, Mr. Attorney, let me cover something with you that's actually going to be probably pretty boring to you. You're probably not going to have much interest in this at all. But in all honesty, it's going to have the single largest impact. Understanding this concept is going to have the single largest impact in your injury claim and therefore the money you make on an injury claim. Now, here's what I just did. I let them know, I stated the obvious, that this was not of interest to them. I know it's not interesting to them. Now, because I did that, it takes the air out of the bag, so to speak, and they let down. In other words, their defenses and resistance let down, and they're more willing to listen to you when you say, hey, I know this is going to be boring information, but bear with me. But I not only told them that, but I gave them the hook. So the hook was, in all probability, it's the single most important factor that's going to determine the quality of your claim, to be honest with you. And I'll share with you how that works. So that was my hook to keep them interested. But just be aware, they don't want to learn medicine, okay? So be highly aware of that. Now I'm going to describe it. Let me share with you briefly the 3 phases of healing, and then we'll share into how they relate into the very importance of how they relate to your injury claims, number one. More importantly, is the financial drivers. Understanding the 3 phases of healing and as they relate to the injury drivers can have and will have a significant impact on your injury claim. And then I'm going to explain to them the 3 phases of healing, what happens in each 3 phases of healing, and consequences, and essentially the therapeutic effect, what I'm trying to do therapeutically in each of these 3 phases of healing. Now, be aware not to get too carried away here. This is a very short description. This is not a discussion at a educational seminar, a healthcare educational seminar. Okay, and then obviously I want to make sure that I put emphasis on the physiological effects of inflammation, physiological effects, especially the 4 negative factors of collagen, relative to strength, elasticity, and sensitivity, and I'm going to make sure that I enumerate the ranges of motion. I'm going to make in the repair phase. I'm going to make sure I talk. Now I'm not solution based here. I'm just telling them what happens. I'm not going into the solution and telling them what happens in these effects, but I'm not going into how I'm going to save his patient. That is not what this presentation is about, is how you can help his patient. That is not. Do not get into how you can help that patient with physical medicine and chiropractic based on the 3 phases of healing. That is not. Don't do that. Don't make that mistake. And it's very easy to do that as a healthcare provider. This is an educational training. It's a sales presentation. This is not a clinical presentation on how chiropractic can help this PI case. That's not what we're talking about here. Don't lose focus on this. So that's the 3 phases of healing, and I'm itemizing them out: the remodel phase, strength and elasticity, etc. All right, next step. I'm going to show the chart. I'm going to show the injury chart, and I'm going to reference it third party based on the Insurance Research Council. This is what the Insurance Research Council has showed relative to injuries. Now, I'll put this in a like a tic-tac-toe type format in a chart, left to right, not vertical like what you're seeing here. So the first column would be the percentage of injury. The next column would be that particular injury. The next column would be what's the objective documentation. The next column is the possible AMA impairment. The next 2 columns, 1 and 2, is the payment, how they're paid. And this is very important. And it's very important to lay it out like this because it's visually much easier to see if you just put it in a little graph like that. It's much easier for the recipient. Matter of fact, it'd be easier for you to see if I would have done that for you instead of itemizing this out 1 through 6. So it's like a tic-tac-toe format in those columns. So I'm going to itemize out. Basically, the Insurance Research Council says 87% of personal injury cases have a connective tissue injury. Would you agree with that? And each one of these components, I want to reverse and get his comment. Would you agree with that? If he doesn't agree, find out what he does agree to and write it down. Don't go into a combative discussion or an argument of the egos. So, percentage of injury, would you agree that, and they're saying that the highest percentage of injuries is the connective tissue injury, and the connective tissue injury is documented by a process called computerized radiographic mensuration analysis, but the injury is called AMSI, alteration of motion segment integrity. And are you familiar with that? Have you heard that term before? Now, the next injury is, and how that injury is paid is either is either through, so I'm just following the column left to right, is either through the insurance adjuster by the documentation and communication to the insurance adjuster. And if you can agree with that, then you get your demands. Or if you don't agree with the insurance adjuster, you can take that injury to a jury. So the second injury is the disc injury. 33% of the personal injury cases have a disc component. The diagnosis, objective documentation is the typical MRI, and the impairment rating can be anywhere from 6% up based on the AMA impairment guides. And once again, you're either compensated by this, by the documentation and the agreement of the insurance adjuster using Colossus type software, or if you decide not to accept that, you have the ability, you have the control to take them to Colossus, to take them to a jury and go after your award. Would you agree with that? And so that's how I'm going to do each one of the injuries. So the next injury, and this is what it would sound like. The next injury is the after the alteration of motion segment area, the disc lesion, then it's the neuropathy. And so essentially that's the tingling and numbness and weakness in the arms or legs that sometimes patients have. And that's documented. That's about 16% of the personal injury cases. It's a lower number. And that's typically documented by nerve conduction velocity or EMG. And once again, the payment is either agreed to with the insurance adjuster or a jury. And the last injury is the mild concussion. About 10% of the personal injury cases have a mild concussion. That's the MRI based. And once again, you're looking at the insurance adjuster in agreement, in negotiation, or having the ability to document this for the insurance adjuster, but definitely for the jury. Okay. So would you agree? And so that's how I would say that. Would you agree that these are, in essence, the majority from top to bottom, the percentage of injuries, the type of injuries you're doing, how they're documented, and essentially how you're paid. It's either your agreement with the insurance adjuster using some type of software, or you take them to a jury. That's how I would sum up and get the agreement. Any modifications or changes he wants to make in there, go ahead and just cross through, write out in your chart. And I do recommend, write out. If he changes the number, if it's higher or lower, do what he says. Go in there, because you're going into agreements. In other words, you're affecting the stair step. You're continually going up the stair step instead of stopping. Next, so that was the injury chart. Now, be aware of what we're doing here. We're taking an injury to an administrative function, to a money function, to a personal loss function. That's what's happening in this presentation. So we've identified the injury, we've identified, and then we're moving it to an administrative function. That was the step, we just moved it to the administrative function. So the next step is briefly describe the 4 steps of a personal injury case. Now, basically, when we look at a PI case, and we're just going to dumb it down, but these are essentially the 4 steps in a PI case. Number 1, did that accident cause that injury? So the correlation, did that accident cause, number 1. Number 2, how well can you objectify the injury with diagnostic testing that shows objectively the injury? Number 1. And the second part of that is, how well does the diagnostic text quantify the injury? How well does it objectify and quantify the injury? That's number 2. Number 3, what is the therapeutic approach? And the therapeutic approach is based on the 3 phases of healing, which therapies you would or wouldn't use and why. And then everything is documented with the initial diagnostic tests, SOAP notes, narratives, reports, etc. So the 3rd phase of case management is identifying the treatment protocol, why you're doing the specific treatment, and the response to treatment of the patient. That's step 3. And then step 4 is when you're at MMI, maximum medical improvement. What is the prognosis? Did they recover 100% from this injury? Did they not? What restrictions, limitations, or inhibitions do they have relative to the injury? That's the 4th step of personal injury case management. Would you agree that in a very simple nutshell, Mr. Attorney, that's essentially the 4 steps in a very simplistic way? That's how that would be said for that step. Now, what's also happening as you walk through these steps, they are consciously, and it may even go from an unconscious to a conscious state, they're becoming more aware that you know your stuff. You know how to put the dots together. You know how to simply explain this, meaning you know how to translate it to a jury. That's very important. So we described the four steps of personal injury case management. Now, here's what we do next is we're going to relate your treatment to each phase of the healing. Now, where are we at in the cycle? We're not in the clinical cycle anymore. We're leaving the administrative component now. We're transitioning from the administrative to the money component of the case. That's what's happening right now. So let me relate the treatment protocol relative to how a personal injury case would heal. Basically, of the three phases of healing, remember we already covered that. Of the three phases of healing, basically you're going to now connect your treatment protocol. Well, in the first phase of treatment is the inflammation phase. Well, the goal there, you've already discussed the time frame and the physiological objectives. Remember, the goal there is to decrease pain and inflammation. And the time frame can be anywhere from up to 72 hours after an injury, as long as there's not a propagating inflammatory factor. So let's go ahead and start transitioning from administrative to money. Now, you want to write this down, and you want to make it sequential, very small and easy to understand. Only do one therapeutic step at a time. And this is what it would sound like. So essentially, the treatment protocol is based on the patient's response to the healing phases, and that also will determine permanency or the degree of magnitude of your injured claim. So let's start with the inflammation phase. So basically, in the inflammation phase, the goal is to decrease pain and inflammation. Now, I'm going to share with you, so what happens is in our office, and let me just kind of give you an example of what it would sound like. In our office in the inflammation phase, we might use ice therapy. Ice helps constrict the muscles, decreases the nerve conduction velocity, decreases pain. We may also use muscle stim, and then we may use either pulse ultrasound, which helps push out inflammation, or adjustment. Adjustment starts to help blocking neural pain pathways, helps decrease the pain. So these are some of the therapeutics that we would use for the inflammation phase of care. Now, in addition to that, so identify your treatment protocol, 1, 2, 3, 4 therapies, whatever. In addition to that, in a column right next to it, you should have your medical team. Your medical team. In other words, in addition to that, at the first stage, my medical team, whether it's my GP or physiatrist or pain management doctor, they would typically prescribe anti-inflammatories or pain pills, something of that nature. So that's what would happen. Now, we're not going to quantify the medical category. We're not going to do that. We're just going to quantify your category. But you definitely want a parallel of the medical category for one reason, is that he sees, remember, he already trusts medicine. That's already in. So you're already leveraging trust by bringing them in to the ticket. So in the next parallel column, write medical team, and then put one or two things that they would do typically, but don't tie a dollar value to that right now. Just associate that medical team with the phase and what type of treatment that is routine for that type of case. So that would be phase 1. So let me share with you the inflammation phase. These are the treatments we would do. We would do ice, maybe muscle stim, ultrasound, and adjustment. I explained the physiology of why, how it totally relates to the objective of the inflammation phase. In addition, the medical, we use support it with our medical team. And typically, they would do muscle relaxers, anti-inflammatories, pain pills, things of that nature. So then add up your total. Well, in my case alone, let's not talk about the medical side right now, but let's add up the fees for my side. So if I charge $30 for an ice pack, $30 for muscle stim, $30 for ultrasound, and $50 for an adjustment, that's $140. So to treat that specific therapeutic protocol for that injury, those are the physiological therapeutics we use. That's how and why we use them, based on the science of the phases of healing. The total cost for that day was $140. Now, the inflammation phase, now add up the length of time. And we would do that typically for 4 days in a row. So take 140 times 4, and you're at $560 for therapeutic, only your therapeutics in the inflammatory phase. You see how you're connecting the dots. Science, this is the science of healing. This is the therapeutic effects. Your therapy is matching the therapeutic effects. You itemize your therapies and you quantify it with a dollar number. Remember, we're transitioning from administrative to money now. Remember, it's clinical, administrative, money, personal loss. That's the presentation. So that's the inflammatory phase. And because we only did one phase and itemized it down like that, it's very simple to understand and present. You line up what you're doing with your therapeutics, okay? Now, I'm going to do the exact same thing with the repair phase. Now, in the repair phase, remember, that's when the scar tissue and collagen comes down, and that collagen's not as strong, it's not as elastic, and it's more sensitive and painful, and there's increased number of nerves. And what's really important is paying attention to the 3 range of motion. If you recall, there was the active, passive, and joint motion. So the therapeutic protocol is to affect the collagen. And physical medicine is very important right now. So we're still modulating pain to some degree. But really physical medicine is very important to affect the collagen formation and the active, passive, and joint ranges of motion. So in the repair phase, I'm going to do the exact same thing. So in the repair phase, let's say I'm going to do chiropractic adjustments. It not only helps with the pain, but it affects the joint motion and the collagen formation. We're going to do some passive therapy, maybe some passive stretching or some passive therapy, again, like ultrasound, whether it's continuous ultrasound now, or neurological stretching, or even EMS. So if you did, let's add that up. So identify your 2, 3, or 4, whatever, therapeutic protocol is you use for that phase of healing. Identify them. Identify the fees. So in this case, the analogy I'm using is the chiropractic adjustment. So in the repair phase, we're trying to affect the tissue in that way. So we would use chiropractic adjustment. That's $50. We use passive therapy. That would be $30. We would do maybe some neurological stretching at $40 and some electrical muscle stim. That's $30. So the range here from $3 to $4 is or 3 to 4 therapies is either $120 for all those therapies to $150 if you did 3 or 4 based on those fees. That's the number. So same thing. What is the duration? What is the physiological duration of the repair phase of healing? Well, specifically, it's anywhere from 6 to 12 weeks. Let's just take a median of 10. Let's simplify it and do a median of 10. So if you take your 150, let's see, if you take your 120 times 10, that's not right. You're going to want to take your treatment, the numbers of treatment first. So they would basically, on average, and remember, we're talking averages. So if the repair phase is anywhere from 6 to 12 weeks, let's say pick an average of 10, so that's 10 weeks. We would see the patient an average of 3 times a week for 10 weeks. 3 times 10 is 30. So if you take 30 times 120, so if we used only 3 therapies, not 4. In other words, the dollar per visit for that day was 120. We took 3 therapies that totaled 120. We multiplied it times 30. There's 3 visits a week times 10 weeks. That's how you got to 30. So take 30 times 120. That's $3,600 of treatment in the repair phase of healing. Make sure you're writing this down. This should be like on a yellow pad, a legal pad. Remember the importance of visualization. And you don't want this customized because then it looks commercial. You don't want this to have this formatted and printed off because then it looks commercial. It doesn't look personal. So you do want to write this down and just memorize the outline and walk through it. So that's how we came to the repair phase, the therapeutics for the repair phase of $3,600. Now, let me point out to you right now, you notice how we're not using high dollar amounts We're not using, $250 for visits and stuff like that, $400 and $500. This is not about blowing the doors off of a case by billing the hell out of the case. That is not what this is about. It's a cognitive, scientific message on connecting a therapeutic protocol with UCR, what's usual, customary, and standard for that case. It is not about blowing the doors off financially and treating and costing on. Now remember, I forgot to say it as I was going through this, but remember, when I identified the therapeutics that I was doing in the repair phase, remember what we said you should also identify? The medical. What other medical is possibly going on? Now we're not going to associate numbers with that. We don't want to create confusion, but we do want to create credibility. So in the column next to the repair phase, I would have put my therapeutic protocol relative to the repair phase of healing. And then in a column right next to it, I said typically in this phase, our medical team might do large joint injections, trigger point injections, things of that nature. So you can see how it could be a larger bill depending on what medical protocol associated with the therapy. But back sticking with the core basics. We're just doing really simple stuff. We're not trying to create a paradigm shift here. We're just trying to make sense in a very simplistic way. So I'm at $3,600 in the repair phase, and that's not including the medical side of support for that patient. And that's the therapeutic protocol of why we did what we did. And then I'm going to do the same thing for the remodel phase. So real quickly, if you take the remodel phase, it's basically 9 months before you get to what's called MMI. After that, the last increase in subjective or objective findings, the next 12 months, now that injury is become permanent. Wherever they're at within that 12-month period, it's now classified as MMI. That tissue is not physiologically, it's not going to get any better from a healing standpoint. Now, essentially, we're just working on functional capacity and symptom care from that point on. It's a permanent injury at this point. So we've got 9 months, there's 4 weeks in a month. Let's say that there's one treatment, 4 times 9 is 36. Let's say in the repair phase, in the remodel phase, there's 9 months left in this thing called the 3 phases of healing. So we got 9 months, and let's say the therapeutic protocol for the remodel phase, if you recall, the model phase was to increase strength and elasticity to prevent recurrence and permanency. And we talked about that already in the repair physiological effects. I'm just reminding them. And so remember, we're just aligning the collagen fibers through active physical medicine to increase the elasticity and strength to prevent recurrence and maximize functional capacity. So if it's 9 months times 4, once a week, 4 times 9 is 36. So I got 36 treatments. Now I'm going to take that times my treatment protocol. So what's my treatment protocol going to be in the repair phase of healing? Well, if I did 36, and let's say the treatment protocol for that was $130, and how I got to that was simply, let's say a chiropractic adjustment was $50, let's say neurological stretching was $40, and let's say you did one active therapy for $40, that's $130. Can you see how reasonable that is? 3 therapies that are very specific for the physiological functions within that phase of the injury based on the science of healing. So I got $130 for treatment. This is all being written down right in front of me. So I got $130. There's basically 9 months left before there's MMI. Let's say they're not better. Let's say they're not healing any faster or worse. Let's just take the average. So let's say it's 1 treatment per week at 9 months. 4 times 9 is 36. I'm going to take 36 times 130. 36 times 130 is $4,680. So I have now in front of me, I have a dollar amount. I've just connected the reason we do what we do, the 3 phases of healing, and the physiological effects. We've identified what we're doing scientifically, therapeutically, because of the physiology of healing. That's what our therapeutics are based on. We're documenting all this. You have to remember, this is what's happening. This is the subconscious byproduct that's happening as you're taking him through. He is seeing you know what you're talking about, and you know how to present this. That's part of the byproduct of this. So we did the therapeutics for each one. We added them up. So the inflammatory phase was 560. The repair phase was 3600. The remodel phase was 4680. So our total therapeutic protocol, totally scientific based and documented, is 8640. And that does not include any of the medical in addition to our medical team. So remember, I'm going to identify my medical team and maybe a therapeutic protocol or two. So in the remodel phase, I may include physical therapy in or in addition to my therapeutics with neurological stretching and chiropractic specifically to affect joint motion, which physical therapists do not affect. So I've identified my phases. I've included medicine, but I'm not going to add up their number because I don't want to create confusion here. And I want it to be about me, not them, okay? So I'm at 8640. So what have I done with my presentation so far? I've taken it from a clinical perspective. I've brought it to the administrative perspective. I've bridged it over. I've brought him along into agreement all the way. Then I've moved it from there into the money, and now we're going into the money, into the award. So here's what happens next is you take the $8,700, and so let's follow the flow chart here. So you would show the cost of each modality for each day in total, each phase of the healing. We did that. We'd add the cost of treatment for each phase of healing, treatment protocol to get the treatment. We did that. Now, here is the key. Next, we have our dollar amount. We have our dollar amount right now. And did we not very simplistically show, without creating massive billing and ridiculous billing, did we not show scientifically the value of this case and how you know how to put this case together in front of this attorney? Yes, we did. The next step is the transition to money totally. So we're starting to go into the injury award pain here as we're transitioning. So the next one is to get agreement. So would you agree that the typical personal injury case settles for 2 to 3 times medical expenses? Now, would you say it's more 2 times or 3 times, Mr. Attorney? So I want him to tell me what the typical medical case settles for. Now remember, he should have already given you at the beginning of the program that number. You should have not only the number he gave you for his medical case, but you should have the average for your regional area also. Both, you should have that number. Because now we're going to start the motivation. Right now we've just supported and made sense. We haven't done much for motivation. Now we're going into motivation. So get the agreement with him. Would you agree it's 2 or 3 times medical? And I'm not even including medical right now. I'm just talking about the chiropractic side of it. Next, use your total cost and relate to adder. So take your total cost, which was $8,700, and multiply it times those two. So if it was your total cost was $8,740, if it was 2 times the case average, that's $17,480. If it was 3 times the case average, you're at $26,222. By the way, is this not totally justified based on how you sequentially put this whole program together step by step, in which this is exactly how you'd be showing a jury? So I've got my 2 numbers here, and I'm going to take his number, do of 2 or 3 times, or twice the case average, or 3, whatever he says. Then I'm going to take the average for your region. So those are my numbers. Now is when the pain starts. Now we're going to start into the motivation of the pain. So you're going to subtract one from the other. You just identified how you totally put a case together that makes total sense in front of a jury or for an insurance adjuster in a deposition. You just put the case together. Now, that alone in a deposition will take the insurance adjuster in a deposition and bring up what he's willing to offer for that case to keep it out of a jury's hands, because now he knows he has somebody that can explain this. this will significantly increase the adjuster's willingness to up the ante. So you got two numbers here, 17,480, 26,220. So subtract the difference. So the difference between, and let's use the smaller of the two. So let's say he says it's only twice medical. So that would be 17,400. Subtract that, 17,400, and I'm just going to round it off to make it simple. 17 from the average. Now I'm going to tell you, and it depends on what part of the country you're in, but the average soft tissue case with no disc injury and all that does not settle for $17,000 or more. I will tell you, if you've done any kind of personal injury, that doesn't happen. That is not the norm, and that is not what he's going to tell you. He will not say to you, yeah, my average case settles for $17,000 with no disc lesion, no broken bones. That will not happen. Now, you take your dollar amount, your 17, and we're using the low ball just to make this make complete sense. So the low ball is 2 times medical, not 3. So let's take the low ball. So 17,000 was what the, if you took my case and multiplied it times 3, you're at 17,480, rounded to 17. And let's say the average case value was 12. And by the way, that's a little high, but most of these attorneys, you're even hearing that they're getting $5,000, $6,000, and $7,000 for a soft tissue injury case. 5, 6, and 7, not 12, and certainly not 17. So these are real practical numbers. And remember, this did not include the medical. This was just your therapeutic approach based on the science of healing and how you were able to identify. So I'm taking my 17 minus my 12, that's 5,000. So the difference is 5,000. Now here we go. So I'm going to take the lost revenue per case and multiply it out times the average number of cases per month. So 5,000, let's say he said 2. So basically, if we were able to do this for those 2 cases, that's an additional $10,000 that month you would have made from that case. You see, $5,000 might not rock somebody's world. $10,000 might not rock somebody's world. So we want to segmentally, stair step. Don't make a leap and go from 5,000 to 1 year. Don't do that. Stair step them through and get their acknowledgement. So this is what it would sound like. So basically, it's possible that you're losing up to maybe $5,000 a case, maybe, by not having a doctor who can explain and demonstrate this in a deposition to a jury. Does that make sense, Mr. Attorney? That's what it sounds like. Well, let's take that scenario, and let's say those are just average numbers, and you said you had 2 cases. Well, that's 10,000. Well, 10,000 might not be enough to, really impact your world either, right? Now, guess what happens, though, when we take that 10,000 and we multiply it times 12? Now, you go back 12 months, go back 1 year. Well, if you take 10,000 times 120, times 12 is $120,000. Now it starts creeping up in motivation. And I not only want to go back 12 months, I want to go back to the beginning of how long he's been doing personal injury and not doing this. Well, basically, how long have you been doing personal injury? Well, if it's been 2 years, if he's been doing personal injury, for 10 years and he's losing $120,000 a year, he's losing $1.2 million a year. That starts to get people's attention. So I not only want to go back sequentially like that, I want to go forward sequentially like that. Well, let's go forward. Let's say, so roughly how old are you? I'm just going to ask their age. Roughly how old are you? Let's say they say 40. Are you ballpark? And let's say the average retirement is, let's say you work to the average retirement age, say 65. So I'm going to take that 25 years. I'm going to go, well, watch what happens in the next 25 years. If it's $120,000 a year, 120 times 25, that's $3 million. So that's a potential loss of $3 million the rest of your career by not working with doctors who not only understand this, have the ability to document it, have the ability to describe it in a deposition if needed. And more importantly, if you don't like what that insurance adjuster is offering you, then you take me to court and we explain this to a jury just like I'm explaining it to you right now. And what do you think the likelihood of an insurance adjuster winning this explanation going in front of a jury is? That's how the communication would be. So we're at $3 million, okay? And we stair-stepped and we got the agreement. Now, it doesn't end there because we're only at a dollar amount. Because remember, when we're talking about motivation, there's three phases you have to go through: admit, consequences, and persuasion. Well, we've got the admit as we went through. Hopefully, you've checked them off. We got the consequences by also the same thing, step by step, taking them and getting them to see the a one-on-one relationship coming through. That's consequences and potential loss and consequences, money. But remember, money's not the end-all issue. It's the personalization, which what they can or cannot do with that money, that is important. And so you continue the process, and here let's move up. Says you take the monthly total loss, go backwards. We've done that. Take the monthly times how long they've been doing TV hard work, and then the same thing going forward. Add the years up. They have left before retirement. We covered that. Here are the questions. This is the third phase of motivation, and there's two key words. Well, first of all, we have to do in a pain-based motivation, number one, loss of money. But there's two key words, affect and feel. Feel is a very important word, and affect. How does this affect the most important parts of your life? So these are the two big ending questions. Mr. Attorney, after I've done everything I've done, and I've stair-stepped them and got these micro all the way along. Well, Mr. Attorney, how would you feel about potentially leaving that amount of money on the table for the rest of your career? Are you okay with that? Now, if they say they're okay with that, you just did a bad sales job. You just did a bad educational training. You are not, there's no motivation. If they say okay, in other words, when somebody is okay with something, there's no motivation to change anything. So you have to ask them, are you okay with that? Number one. And the key word there was feel. How do you feel about potentially leaving $3 million on the table for the next 20 years, 5 years of your career? Are you okay with that, Mr. Attorney? That's what it would sound like. Number two, remember, we're talking about the personalization. Number two, how would larger settlements affect your personal life? In my experience, now I use a third-party experience. In my experience, most personal injury attorneys I know would pay off their credit cards, pay down their mortgage, and take a few more nice vacations. Now, let me say a couple points about that. When you're an active listener and you're good at sales, you can lead them to the point that is bothering them the most. But if you don't have active training, then do a menu. These are the three things that I just pointed out right there, are the three highest probability factors that attorney would do if they had more money. And those are all facts. And they're facts of white-collar professionals in general, but definitely attorneys, that white-collar professionals, it's well known, they live above their means. They live on credit. How would you like to pay off your credit card debt? So that's a pain-based, real, personal problem. Pay down your mortgage. Typically, white-collar professionals buy a house larger than the financial ratio of which they can afford. That's a fact. These are high probability, common facts. And so that's why if you say them in a third-party format, and I say it in a third-party format, in other words, attorneys I would know, they would do this, this, and this. In other words, it's out here. So I'm going to say the negative and then bring that negative back and attach it to them. In other words, you wouldn't say this. Well, would you pay off your credit cards? Would you pay off maybe your mortgage a little more? You're asking for a very defensive reaction now by confronting them head on with that question. You're asking for them to back off and move away from it. So how you do that is you third party the negative. And it sounds like that. In my experience, if the attorneys I was working with had an extra $3 million, the three things that I'm aware they'd probably do is pay off the credit card debt, pay down their house, or pay off their mortgage. And to be honest with you, they'd probably take a little more time off to take nice vacations. Now, what would you do with $3 million, Mr. Attorney? How would this affect your life? You see, that's how it would be asked. State the negative over here and then come back and attach it over here to them. And chances are, when you do it that way, they'll go, I'd probably do the same thing, something along those lines. So how would you handle, so the last question, how would you handle getting larger settlements and the rest of, how would you handle demanding and getting larger settlements the rest of your life? You want to position them into where they feel that this is real, that they can see it, they can taste it, they understand it. You want them to feel like it already exists now. In other words, I got it. With you, I can see this happen. That's the feeling you want to create. You want to so after you establish the motivation, you definitely want to show them that it can happen. But what's the clue? The clue is you. You're the keystone in the whole thing. This is how you create the motivation, and the focus goes on you. Now, the next one is, who's going to support your injury demands if you do not have a doctor who can document and explain these connective tissue injuries to an insurance adjuster or a jury? How are you going to get these larger demands or what you want if you don't have a doctor who can do this, connect these dots and explain it? Next one. I'm just curious, when will you take control over your injury demands and not let the insurance adjuster or some software program dictate your income? Do you really think an insurance adjuster and a software program is going to increase your income every year from here out? Or do you think they might want to try to reduce as much payment for you every year as much as possible? That's how it would sound, okay? Where but also you've showed them the way out. What is the way out? What is the answer? The answer is you. You are the answer. You are their ticket out. This is when you ask for the referral now. If they have any clients at all, you should be getting referral right now. You should be asking for the referral right now. Which of your present clients do you have that may have a connective tissue injury that this information may not even be documented properly and therefore limit and void your injury claim and actually make you a hostage to the insurance adjuster? Which clients do you have right now that could benefit? They do have somebody, and this typically is at the end of this presentation. I will always get a referral. And then the last one is, when would you like me to do a preliminary evaluation to determine the financial drivers of your client? So that's the information. I'll share with you a quick story, and then we'll open this up to questions. A modified version of this, not a well-trained version, was done by one of my clients. Went to the attorney, and he started his normal stuff. He did not use my material. He was smart enough to notice this, what was happening. In other words, I had educated him enough to know of the dance. This is a dance. The educational training sales is a dance. So he started his normal stuff, chiropractic, blah, blah, blah. And the attorney went right into minimizing and denial. Yeah, I love this, love that. Yeah, blah, 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 blah. In other words, he saw that this attorney, there was no need being established, and this attorney was okay and happy door. Well, he knew from my training that if that person's okay, you're not getting any business. So he immediately clicked, and he went into some of these components. He goes, let me share with you what we're doing here. And not exactly these words, but you get the point. Let me share with you what we're doing here to help with your injury claims. He covered a few of these points. On the spot, when he finished a few of those points, on the spot, the attorney picked up the phone to his front desk girl and told that girl to call his particular client and send them to get an evaluation from this doctor, the doctor who just had given him this presentation. Now, how I know this is he told me what happened. And here's what is really interesting about what happened. On the way back to his office, he's driving back to his office, and his secretary calls him on the phone and says, I don't know what you did. What did you do to that attorney? He goes, what? He goes, not only did he send that person, when that person called in, he called in and sent another personal injury case over. That one lecturer was responsible for 2 cases immediately because he knew how to hit the buttons. He knew how to hit the emotional buttons. He knew how to create loss, and he was the solution. He was the solution. So this is why it's so important, and this is why the market is so big. The market is huge because the majority of personal injury attorneys don't know what we just covered, number one. Number two, you got to remember, over 75% of the personal injury attorneys don't refer out cases. They're not proactive in their management. And then 87% of the cases have connective tissue injuries, and only a third of them, 33%, have a disc injury. So 33 from 87%, that's a good percentage of people that have only connective tissue injuries with no other injuries, like a disc injury or an NCV. That's a wide open market, but the problem is the ignorance, the unconscious incompetence of the attorney, and unfortunately, advertising alone will not shift and take them through psychologically what we just took them through. So you have to know educational sales, you have to know these components, and when you do and you have the ability to communicate them, it's a tremendous opportunity for a tremendous amount of business. And then the last one is you have to remember only 32% of patients see chiropractors. So 68% of the patients don't even see chiropractors. And 87% of them easily have a connective tissue injury, forget the disc and everything else. So this is the power of understanding educational sales and the steps included, and changing your skill set level, having some knowledge and ability, and then incorporating this whole into a system, incorporating it into a campaign. In other words, not just a cold call and let me wing it and go after the biggest fish the fastest when you're the most ignorant and you have the least amount of skill level to present this information. So this is the power and information of this. So we're going to go ahead and finish up with the presentation now and open up for any questions. Any questions? Any questions?
My question, Paul, is, can you hear me?
Yes.
Okay, my question relates to the price of the care, or the total cost of the care. So, I mean, $8,700 is pretty substantial. You know, I hear in my area that most of the attorneys don't want to deal with anything over about $3,000, $3,200. What's the answer to that?
Well, what do you think the reason is that they have that perception? The reason
they can't justify. They can't get the bills paid once they go beyond that.
Well, it's a deeper reason than that. Because if that attorney knew what we just covered, and he knew about connective tissue injuries and the phases of healing and duties under duress and lifetime enjoyment activities and a permanent prognosis, and he had a doctor who had the ability to document it and go to court and explain that to a jury, guess what happens to your likelihood of that attorney stop accepting what the insurance companies are doing and every now and then suing them?
Okay, so that has been your experience. You've seen those attorneys learn that new trick.
This is exactly what I did.
Okay.
Here's the problem, though, is they don't know what they don't know because you, in the past, haven't been able to explain it to them, and so they don't want to go to court with your previous knowledge.
Gotcha.
Would you?
No.
That's the real issue. So it gets back to educating your attorney and having them highly aware of look how much control they have in their case if they knew all this, Barry.
Yeah, they'd have total control.
And look how much more control and confidence they'd have if they had a doctor like you that could explain it like I just did in front of a jury.
Well, that leads to my second question, Paul. Would it be possible, because this would be a lot easier for me to grasp, if you would make a video of you doing the presentation just like you're talking to an attorney? Would that be possible to get that done?
No, I just did. Each one of the steps, I just told you how I would state each one of the steps if I was sitting in front of an attorney. That's exactly what I just did.
Okay.
Here's the real issue. You've got 4 stages of awareness. This takes you from unconscious incompetence to conscious incompetence. It does not mean you have the skill to do it now. You're going to have to give this presentation. And I suggest you give it to your daughter, your wife, your mother, your father, everybody but an attorney until you can explain it step by step, and the person sitting across from you goes, that makes a hell of a lot of sense.
Okay.
And you can, in other words, you can now do it at conscious competence. But here's the problem, Barry. So many people will never do what I just told you. They'll never own the skill set, and they'll be still intimidated and not to talk to the attorney, or they won't own the skill set and they'll go and try to talk to the biggest attorney they got, and they won't have the skill set, and the attorney will see right through it that you don't really know and have the confidence to present yourself in a deposition or a jury.
Okay. Let me ask the question in reverse then, Paul. If I got to the point where I felt like I was pretty confident in doing this, would you review a videotape if I sent you one of myself doing it, giving it to somebody else?
Yeah, that's a very good question, very fair question, and I'd love to do that.
Okay.
But remember, when I did training, remember there's 4 steps of training. There's 3 components to another level of your life. There's 3 components. Number 1 is the knowledge. Well, Barry, knowledge is everywhere. I mean, it takes time and energy to find it and assimilate it and make it simple, but that still is only one of 3 factors. The second factor is motivation. How motivated is somebody to apply the knowledge? The third factor is skill set. How well did that person go through the 4 stages of awareness to increase their skill set, and how motivated are they to present the content? You got 3 different factors that play a role here. And I'll just tell you what shoots people down. Number 1, chiropractors. Number 1, they don't know this in the first place. When they do see it, some of them aren't real motivated to go act on it. They're afraid, to get in front of an attorney or start the process or communicate. So the motivation lacks. But really what happens is the next step is the skill set. Nobody is willing to go through role playing. Nobody likes role playing, and role playing, you got to remember, to get from the conscious incompetent state to the conscious competent state, you have to do certain things. First of all, you got to overcome fear and rejection, which are primary and secondary factors to inhibit you. That's that negative self-talk crap. Not only do you have to understand and deal with that, but you have to apply multi-sensory. You have to apply sensory and motor. Sensory and motor, and you have to do it over a 21-day period, because that's what creates a neural link. A neural link. And that neural link now is the conscious competence phase. But what I explained to you, people don't know, Barry. And they don't know how to get over that hump. That's what good training is about. So you got 3 factors. You got the information, you got motivation, and then you have the 4 stages of awareness. And the biggest part that people have trouble overcoming is the fear of rejection and lack of motivation, and not being willing to do the workshops to make it sensory and motor to create a neurological synapse to affect your skill set. That was a lot of information. I just said in 3 minutes.
Paul, this is Doug. I think one of the most important things is really objectifying the connective tissue disorder. And obviously we can do that in our notes and with the motion x-ray. But one of the things that attorneys really count on is getting the backup of your medical team. And I guess this is more of a statement than anything. I have one case where I have a 14-year-old with a herniated disc, and I'm at like $8,000, $9,000 in charges, and the attorney wants a write-up or narrative from the medical physician to back up what I've done.
Now, 2 comments relative to that. Why does the attorney, this is a rhetorical question, why does the attorney want the medical backup? Well, for 2 reasons, really. Number 1, he doesn't have the confidence in chiropractic number 1. Number 2 is medical already is branded. medical is already accepted. So those are the two reasons. Now, you can and should affect both of those. And how you do that is you have a medical team. So I had a medical team. So when you have this objective information, you do want your medical team to sign off on it, number one. That definitely makes it easier. But number two is when you show the confidence that you have the ability to describe this to an adjuster and, more importantly, to a jury, that's when his confidence will grow in you. But that will take a lot more effort. You got to remember the big case, the first big case that put me on the board was me going against two medical doctors. It was not even supporting medically the injury or a chiropractor support. It was me going against two medical providers saying nothing was wrong with the patient. So I not only had to overcome objectifying and documenting and being able to have the skill set and ability to do that, I had to counter the total trust of a jury in medicine. So you got two issues. So number one, you definitely want a medical team. I explained how to put your medical team together and how to use them. Yes, more importantly, the medical team will become less relevant when you have the ability to show this attorney and present this information to him and in a deposition. That's when that attorney will become less sold on the medical. So yeah, you do. Chiropractic has done a terrible job of branding itself.